Corey Drakes is a medical physicist. I ask the question, what is that about? And so he can have answers for me, no doubt. There's a rhyme there somewhere. And so, Corey Drakes, good morning to you.
Good morning to you. Good morning to Barbados.
What is a medical physicist?
Well, that's a good question because usually when I mention that I'm a medical physicist, a lot of persons ask the question. So basically, a medical physicist is a professional who apply physics to clinical settings to ensure that technologies such as CT scanners, X-ray units, even the medical linear accelerator just acquired by the hospital is used in a safe and effective manner.
So how do you get to do that?
So I'll tell you a little bit about my journey. So I attended the St. Leonard's Boys School and fell in love with physics because I was always a very curious person. I always wanted to know, how does something work? Why does it work the way it works? And I decided to channel my career path down those particular lines. So after St. Leonard's, I attended the Barbados Community College, graduated there with my associate degree. After that, University of the West Indies, physics and math, double major. And then between 2013 and 2014, I actually volunteered at the hospital 8 hours a day, 5 days a week, for almost 10 months with the medical physicists there. And it was at that time I really saw how physics can be applied in a clinical setting to save lives. Fortunately, in 2014, I won the 2014 Commonwealth Scholarship, and that enabled me to do my master's in radiation physics and biomedical engineering at the University College of London in England. So that was my journey in becoming a medical physicist, but it's the curiosity of wanting to know, how do things work? I was able to pursue that area.
Some would say, well, that's an engineer. You could just unscrew this, screw it back together and figure it out all on your own. But you tackled it as a medical physicist because you want to look at how technology really can be applied within a medical environment and how that can benefit the patient outcome.
Yes.
And so with all of this, the practical, you invested over 10 months, you said, as just volunteering. I just want to rub shoulders with you, I want to work alongside you to get a sense of what it is you do, and that inspired you even further to be able to pursue the studies that you do. Is this the trajectory for your life that you've always had?
Well, to be honest with you, I think my love grew, around third form at the St. Leonard's Boys School. And then I was introduced to medical physics at the Barbados Community College. What I would say is that I love science. I love to help people. I never really liked blood. I think medical physics was the perfect union between loving to help people and loving science. So after given that opportunity to volunteer at the hospital, I really fell in love because I saw how radiation, for example, something that people fear, could be used in a safe way, in an effective way to diagnose and also to treat.
Are there many of you in Barbados, people who are known as medical physicists?
Well, I'm the only one who works in the private sector. I think there's one other person in the private sector. But what I would say is that there's a deficit of medical physicists all throughout the Caribbean. And I've spent over the last couple of years trying to put mechanisms in place to build that capacity of medical physicists, not only for Barbados, but for the rest of the Caribbean.
How do you go about doing that, to build the capacity for more?
Sure. So over the last couple of years, since 2018, I would say, I would have done some collaborative work with the International Atomic Energy Agency. They're the persons who are the watchdogs for the peaceful uses of ionizing radiation, which is the type of radiation that we use in medicine. And I would have done a SWOT analysis with them for the Caribbean to find out where these gaps exist in terms of radiation medicine. And human resources came up. We looked at medical physicists and we wondered, how can we close these gaps? So now what I can say is that there is a medical physicist master's program affiliated with the University of the West Indies Motor campus now, and they also have a residency clinical program associated with that. Back in 2014 when I studied, that didn't exist.
Mm-hmm. A medical doctor, we know they work with the scalpel. There's some of them who are surgeons who work with scalpel, but they have their stethoscope and like. A medical physicist, how can we identify with a naked eye that that man is a medical physicist?
So usually at the hospital, if you see someone walking around with a big briefcase, looking as though he's carrying a lot of money in it, Usually that is quality assurance equipment. Because medical physicists, we check behind calibrations. The engineers, they say that, this system is good, it can be used for patients. But we have to check behind those calibrations to make sure that that machine is working in a stable way, that the radiation emitted is actually what was programmed and not emitted based on however it felt it working on the day. So we do a lot of behind the scenes work. In radiotherapy, for example, I do all of the treatment planning, which is kind of complex. But when we are treating cancer with radiation, we want to ensure that those cancer cells are the only cells affected by the radiation. So those persons who see people walking around with those big briefcases at the hospital, usually that guy is a medical physicist.
And so how do you, just for my own curiosity, you have a treatment plan for a cancer patient.
Yeah.
The cancer is located, for instance, in the stomach.
Yes.
And you want to do some radiation, if it's possible at all,
Sure.
on this. How do you determine that plan to isolate
Yes.
where those cancer cells are so that you don't affect the other good cells?
That's a very good question. So usually I work with a collaborative team, radiation oncologist, who is responsible, or who is the strategist really, who is responsible for prescribing that radiation dose. The medical physicist would then take over from there. We use something called a treatment planning system. And we normally set objectives for that treatment planning system. So this is the prescribed dose that I need to cover that particular target volume. And these are the organs at risk that are in close proximity to that target volume that need to be spared from the radiation. And that treatment plan has something called an optimizer, and it basically solves equations to ensure that we are meeting these objectives of the target volume and also reducing the radiation dose to the normal tissues surrounding that target volume. And it can be pretty complicated to explain, but again, we do have mechanisms in place to ensure that after that treatment plan has been created, that the radiation can actually be delivered by the system. And we do have radiation technologists and stuff who is responsible for working with the patients on the system to get them set up, we put them into a reproducible position so that we can deliver this radiation over a course of treatments. Sometimes that can take up to 30 days.
I suspect that none of you in the medical profession wants to get it wrong. And so, do you have those nights where you think, oh boy, tomorrow we have a procedure, I just don't want to get this wrong? And that anxiety that comes as a consequence of every case?
That's it. So every single case, I tend to feel this way because I know that radiation is high risk. We can use radiation to destroy cancer cells, but the radiation can also induce cancer as well. So we do have to be spot on, and it takes some effort. But I would say that I work with a wonderful team in the oncology department at the hospital, so that helped reduce my anxiety a lot.
So you can have some sleep, you can sleep at night. And so there's a new piece of equipment that's been installed or being to be installed at the Queen Elizabeth Hospital, soon to be operationalized. Talk to me a little bit about that and its benefits to Barbadians.
Well, this piece of equipment is definitely going to modernize and revolutionize radiation therapy in Barbados. So this piece of equipment has a lot of features in comparison to the previous piece of equipment, where we can give highly accurate and precise radiation therapy, and therefore the radiation oncologist who is responsible for prescribing that radiation dose can now prescribe definitive doses that can definitely eradicate the cancers. And the system is so special, it has an onboard imaging system where we can view the anatomy on the day to see where the target is, and then make small adjustments to the patient to deliver this precise and highly accurate radiation therapy. So I think it's a good step in the right direction, and we are looking forward to making it operational in the coming weeks. So
what were we doing before?
So we were using older technology, but as you know, medicine is evolving, the technology is evolving, and our healthcare system also have to evolve in order to keep up with best practices. And I think the government would have made the right decision in trying to reduce the mortality and morbidity associated with radiation treatment, and I think this was a perfect move in the right direction.
To a little youngster who were like you, in secondary school, got turned on by physics and wanted to pursue this, what do you say to that child who's watching today?
So Physics is not really about, just equations and theories. It's something that can actually save lives. And if you are curious and you're thinking about pursuing a profession where you want to apply science, you want to get involved with cutting edge technology, and you want to change the lives of people and family, etc., I think this is a rewarding job.
It's a rewarding job. And so you take the same route that Corey took, perhaps, of pursuing then further at the Barbados Community College and on thereafter,
Yes.
so that you do have your qualification to be a medical physicist.
Yeah.
Do you get the title DR at some point?
So you can actually do a doctorate of medical physics if you choose. But because I am not really into the research area as yet, I think the master's level would give you the competencies and the skill set that you need to be able to work in a clinical setting on a day-to-day basis.
You said as yet, that means you're heading for it.
Definitely.
See,
Definitely.
there you go. Why stop now?
Yes.
Why stop now? We got to stop now.
Yes.
Corey Drake's medical physicist at the Queen Elizabeth Hospital. Good to meet you. Good to know more about what you do. And good to know that at the hospital now we have this cutting edge piece of equipment that can more detailed approach and tackle some of the cancer cells in our population. Indeed, well done.
Thank you.
As a good St. Leonard's young man.
Yes.
So St. Leonard's, you have a lot to be proud of. Corey
Of
Drakes
course.
represents you beautifully indeed. Thank you so much for joining us.
Thank you.
You're very welcome.
Morning, morning, morning. Good morning. Good morning to you.